News and Events COVID-19 on June 16. Note, this is a collaborative video made between Travel for All Fanpage and Knowledge of Coronavirus channel. Please respectfully welcome everyone. The following is the remarkable news most on June 15 as follows. 1. American news. The United States could see more than 200,000 deaths from COVID-19 by October 1, a closely watched model predicted Monday as states continue to reopen. More than 2 million have been infected by the virus and 116,125 have died, according to data from Johns Hopkins University. Though many states are seeing improved conditions, the pandemic has not yet reached its conclusion. The projection comes as 18 states are still seeing an upward trend in new cases. The United States, the most affected country in the world, with more than 2,182,950 cases and more than 118,283 deaths. June 15 recorded the lowest number of deaths, 382, since mid-April when the epidemic hit. Culminated in this country. Recently, the U.S. recorded an average of less than 1,000 deaths a day due to COVID-19. However, the U.S. continues to have about 20,000 new cases each day. The number of SARS-CoV-2 infections and hospital admissions on June 14 hit a record high in many U.S. states, including Florida and Texas. The data raises concerns about a second wave of outbreaks as states prepare to fully open their economies while some states have not yet met the conditions for reopening. The U.S. Food and Drug Administration, FDA, announced the withdrawal of emergency authorization authorizing the use of antimalarial drugs hydroxychloroquine and chloroquine to treat patients with COVID-19 due to an increasing number of there is ample evidence to show that these drugs are ineffective in treatment and that they can have fatal side effects. With this notice, federal government drug lots will not be distributed to local health authorities. 2. Update COVID-19 in the world. As of June 16, 2020, COVID-19, an acute respiratory infection caused by a new strain of coronavirus, was first detected in Wuhan City, Hubei Province, China in December 2019. Later, the disease spread to many provinces in China. To date, 215 countries/territories around the globe recorded cases, in which the United States is the country with the highest number of infected people in the world. 8,142,820 people get infected, 439,768 people die, of which the United States has 2,182,950 people infected, 118,283 people died. Brazil has 891,556 people infected, 44,118 died. Russia had 545,458 people infected, 7,284 people died. India has 344.407 people infected, 9,921 people died. The UK had 296,857 people infected, 41,736 people died. Spain has 291,189 people infected, 27,136 people died. Italy has 237,290 people infected, 34,371 people died. Peru has 232,992 people infected, 6,860 people died. Germany has 188,044 infected people, 8,885 died. Iran has 192,439 people infected, 9,065 people died. Turkey has 179,831 people infected, 4,825 deaths. France had 157,220 people infected, 29,407 died. According to the Worldometer statistics page, the world recorded 8,107,424 cases of COVID-19 acute respiratory infection caused by COVID-19, including 438,580 deaths and 4,187,421 recovering. 3. Brazilian news. On the same day, the Brazilian Ministry of Health reported an additional 23,674 cases of 19 COVID infections in the past 24 hours, bringing the total number of cases to 891,556. The city of Santana, do Livramento in southern Brazil bordering on Uruguay had to issue a curfew at night due to the strong spread of the disease and severely affecting the Rivera city of neighboring Uruguay due to people from both sides often cross the border. Although only 83,000 people live, health officials have been forced to list Santana do Livramento as a high-risk list and allow only some basic services to be opened. 4. Mexican news. Mexico is believed to be in the peak of the COVID-19 epidemic, with 146,837 cases, including 17,141 deaths and 52,636 suspected cases. The country's Ministry of Health predicts that the number of deaths could reach 35,000, and it is expected that the first wave will last until October and the second wave is expected to occur in late November or early May 12. 5. China news. On June 15, the World Health Organization, WHO, announced that China officially recorded more than 100 cases of SARS-CoV-2 during a new disease outbreak originating from markets in the northwest. Qin, at the same time, is investigating the origin and scale of this outbreak. The CGTN news agency reported that on June 15, Chinese health officials are searching for all those who have been to the Tanfatia wholesale market, Beijing, since May 30. An estimated 200,000 people have arrived. This market has been closed since then until June 13. 6. In Colombia and Central America. In Colombia, the number of COVID-19 cases has exceeded 50,000, namely 50,939, while the number of deaths is 1,667. Meanwhile, in Central America, the number of COVID-19 cases in Panama, Costa Rica, Honduras, Guatemala, and El Salvador continued to increase sharply as 1,629 new cases were recorded, bringing the total number of cases to 44,067, including 1,198 deaths. 7. In India. In India, the city government of Chennai, capital of Tamil Nadu state, announced that it would reimpose a blockade from June 19 until the end of the month, as new infections have risen sharply in the region. To 15 million people, India continues to record more than 10,000 cases of COVID-19 each day. To date, the total number of people infected in this country has reached 343,026 cases, the fourth highest in the world after the US, Brazil, and Russia. 8. Japanese news. Japanese Prime Minister Abe Shinzo warned of the risk of an outbreak again amid a surge in new cases in Tokyo in recent days. Prime Minister Abe warned people not to be subjective, that the virus will weaken in the summer because the dangerous virus still spreads, even in extremely hot countries in the Middle East. He also emphasized the need to prepare to deal with a second wave of infection by strengthening the health system and increasing virus testing. 9. Thai news. On June 15, Thailand recorded no additional cases of COVID-19, marking the 21st day of no cases of infection in the community. To date, Thailand has recorded a total of 3,135 cases, including 58 deaths. This is also the day marking Thailand entering a phase 4 of a blockade easing, along with a night curfew being lifted, and many activities in the highest risk category are resumed, despite the ordinance on status. The emergency is still valid. 10. Singapore news. Singapore government confirmed that, starting from June 19, it will enter Phase 2 of the process of opening the economy after more than 2 weeks of implementing Phase 1 opening from June 2. In Phase 2, most of the social and business activities will be resumed, such as retail business, food shops, social gatherings in small groups of 5 or fewer, refresher courses, healthcare services, sports centers will be reopened. Students from all levels come to school every day. However, some activities have a large number of participants, such as religious services, large cultural venues such as libraries and museums, large-scale events such as conferences, exhibitions, fairs, and entertainment venues such as bars, cinemas, and nightclubs remain closed. people still have to keep a safe distance of at least 1 m and wear a mask when going out and at work. 11. Philippines news. In the Philippines, the total number of COVID-positive cases 19 reached 26,420 after the Ministry of Health announced it recorded an additional 490 cases. The daily death toll is 10, bringing the total number of non-surviving patients in the country to 1,098. 12. Iran news. Iran has warned that it may reapply strict restrictions to ensure a social gap to prevent the spread of disease after the country has recorded more than 100 deaths from the disease for the second consecutive day. 6. On June 15, the Iranian Ministry of Health announced another 113 deaths from the COVID-19 epidemic, bringing the total number of deaths to 8,950. In addition, 2,449 new cases have been confirmed, bringing the total number of cases in Iran to 189,876. 13. Egyptian news. The Egyptian Ministry of Health announced an additional 1,691 SARS-CoV-2 infections, bringing the total to 46,289. In addition, according to the agency, an additional 97 patients died from COVID-19 in the past 24 hours, the highest number recorded in the day since the outbreak, bringing the total number of deaths from the disease. This danger has reached 1,672 people. In addition, 398 patients with COVID-19 recovered and were discharged, thereby bringing the total number of patients to 12,329. 14. Vietnam news. In Vietnam, there have been 61 days without any cases of infection in the community. The number of recorded cases of COVID-19 was 334, of which 323 patients were declared cured. Out of 11 patients still in treatment, 5 had a negative result of SARS-CoV-2 from one time or more. 15. Canadian news. On June 15, Canada held the 5th ministerial meeting of the Ottawa Group on reforming the World Trade Organization, WTO, in a global context facing unprecedented challenges stemming from the pandemic of acute respiratory tract COVID-19. The Ottawa Group, including Canada, Australia, Brazil, Chile, European Union, EU, Japan, Kenya, Mexico, New Zealand, Norway, Singapore, South Korea and Switzerland, are trying to find solutions to people are safe and support businesses and workers. At this online conference, ministers from 13 economies of the Ottawa Group discussed what WTO and the statutory trading system could do to mitigate the impact of the COVID-19 pandemic, placing the foundation for sustainable recovery and adjustment of trade rules to cope with future crises. The Ottawa Group agreed on specific steps in the Ottawa Group statement, focus on responding to COVID-19. 16. Global trade news. COVID-19 has reshaped the global trading system and it needs more adjustments. The first is that restrictions can continue after the COVID-19 epidemic ends and the scope will spread to other products. Requirements such as licensing, standards, labeling, etc. may increase, especially for a range of consumer goods and food products, on the basis of human safety and health. Moreover, protectionists can see the crisis as a rare opportunity and use this as an excuse to impose technical requirements on imported products to address the trade deficit. Second, while barriers dominate, governments and businesses can rethink and restructure their dependence on supply chains. Protectionists will want to bring the supply chain back to the country, while trade liberalists will promote further diversification of the supply and import chains, but will introduce a discipline. Certain trade to manage and secure supply chains. Either way, commercial discipline will be different than before and more defensive. Third, the market will change in many ways. Companies will depend heavily on technology. The retail sector will witness an increase in e-commerce. Industries will quickly shift to automation and less labor to ensure predictable activities even in times of crisis. More importantly, consumer behavior will change and will require higher standardization of products due to health and safety concerns. Accordingly, the way the industry operates will be changed and forced to meet higher standards. The market will set its own regime. In the end, the world cannot fight without coherence.
States must be able to coordinate trade measures and ensure complementary to national policies. Our newsletter is now over. Thank you for always watching and supporting our videos. Knowledge of coronavirus, channel and travel for all fanpage respectfully, and see you in the next video.